Now, if you or someone you love has diabetes, this video might save you a lot. It might save you your life, in fact. Today, I'm going to be telling you about somebody, and for the sake of confidentiality, I'm going to keep his name as Tunde, and he's a 58-year-old man who is living with type 2 diabetes. He learned something the hard way, unfortunately, and that's what I'm going to be discussing with you right about now. So Tunde has been managing diabetes for over a decade. He wasn't perfect. He sometimes missed his medication or even enjoyed sugary drinks or meals. But one day he noticed something strange. Actually, he had been noticing this for a period of time. So he felt that his feet were numb, and that description is best as when you are wearing socks. You know how it feels when you have the socks on your feet, but actually you don't have it. That's what numbness looks like. So he felt that way, and at some other point again in the course of that time period, he was also feeling like his legs were burning. He felt like he had electric shocks on his feet and his legs generally. Sometimes he would even lose his balance for no reason. And one morning, he noticed that he stepped on a pin and he did not even feel anything. So when that happened, he was quite worried. He got up, he knew something was wrong, and then he had to get to the hospital. And after assessment and everything, he was made to know that he's got diabetic peripheral neuropathy. And I'm going to be discussing this in details. So what is diabetic neuropathy? This is what happens when the blood sugar gets too high and it begins to damage the blood vessels that supplies the nerves. Again, I'll take that. The blood sugar gets too high, which is what exactly happens in diabetes. It gets too high, and that high blood sugar begins to cause damage to the blood vessels that supplies the nerves. And that is what we generally call microvascular complications. However, there are four main types of these neuropathies, depending on the area of the body that they affect. One, there are those that affect the feet and the legs, which is the one I described in Tunde, and that is peripheral neuropathy. And that's the one that causes the tingling sensation, the burning sensation, the numbness, or even the sharp pain people feel on their legs and their feet. There is also the autonomic. Autonomic actually describes those parts of your body that you don't have control over. And the neuropathy in that area has to do with digestion. So, digestion, arteries, or bladder. And this is called autonomic neuropathy. There's also the proximal neuropathy, which is the sudden pain or weakness around the hips or even the buttocks or the thigh. There's the final one, which is the focal one, the focal neuropathy, and it's focused in a single area, and it particularly targets a single nerve. It could be the single nerves of the wrist, it could be that of the face. But for sake of simplicity, what Tunde has is what we call peripheral neuropathy, which is the most common type. So when Tunde went for a checkup, the nurse actually examined his feet because from the history he gave, he had actually stepped on a pin and he never felt it. And at the time his feet was carefully examined, there was a part where there was actually an infected wound, and he had no idea of this, which is typically what you see with people with neuropathy. So his explanation is simple. The nerves have been damaged, and that's why he never felt it even when he had an injury. And the implication is if we don't act, we don't get to do something, it could even get worse. And sometimes it could lead to what we call amputation, that is the cutting off of that particular body organ. So you probably have seen or heard about somebody who's got diabetes or who's been amputated, and they say because he has diabetes. This is how everything began. The numbness, the experience of not feeling pain even when they step on sharp objects, and then it leads to injury, and the injury decays and worsens because they don't even feel the pain, and it gets to a point where they have to cut off that part of the body. So Tunde was really shocked, and like you might also be shocked, but it was also a wake-up call for. Now, kudos to Tunde. He was very, very proactive. He was right on the game. Immediately, the diagnosis was made and the team spoke to him about it. He got very serious. He began to check his feet every day, so he was tutored on how to do that. He was educated on how to do that. He kept his blood sugar within the target range. Previously, he doesn't really care as long as he's not feeling sick himself. He feels it's okay. However, he now began to focus on the target. It's a target range that was set in by the doctors, and he focused on making sure his blood sugar was within that range. Right, and then he also ensured that he was exercising quite well, because that generally helps to keep your blood sugar levels low or moderate. That was about 3 to 5 times in a week. He had to quit smoking because he used to smoke cigarettes. So he had to quit smoking tobacco. And he also ensured that he took his checkup regularly and he took it more serious. He was seeing his foot care team regularly. Now, they gave him a special kind of shoe to prevent blisters, and those shoes would also prevent pressure ulcers, because the regular shoes we wear have a tendency, if it's not well carved and managed, it can easily damage the feet. Now, his symptoms did not eventually disappear overnight, but things began to change. Bit by bit, the balance improved, and more importantly, it didn't get worse. So the injuries and everything did not go worse. It was They were able to nip it in the bud and began to work towards a recovery for him. And this is the line that caught my interest the most. And he was saying something around, I may not feel everything, but now I know I need to pay attention to what I don't even feel. And that was very profound for me. Right now, so what I described is very common. And maybe you have somebody who has also experienced this. You can tell me in the comment section. The neuropathy, however, is preventable and it's manageable. And some of the tips, general tips, are that you need to check your feet regularly, and you need to take your medications, of course, to keep your blood sugar in control. You need to make sure that you don't ignore the warning signs. So if you notice that tingling sensation, the numbness, or the burning sensation on your feet or any part of your extremities, your fingers, you might need to just report that to the doctor. And just to say, never be afraid to ask your healthcare team for help. I hope this has helped you. Thank you for watching. Please subscribe, and please know that you are not alone. Your nerves matter just as your life matters. Bye bye.